Hi, I'm Joe Ruffolo. I'm the President and Chief Executive Officer of Niagara Falls Memorial Medical Center. And we're here today to give you an update on all of the planning and preparation and precautionary measures that Niagara Falls Memorial Medical Center and its team have done and continue to do in this very fluid situation with respect to addressing the coronavirus. So to my right is Dr. Rajendra Bajwa, and Dr. Bajwa is our medical director for our chief of infectious disease. Highly skilled, highly educated, did his residency at Allegheny General Health System, one of the largest systems in the United States, Pittsburgh, and did his fellowship in infectious disease at the University of Buffalo, and has been our chief for 7 years. So he's highly skilled, very competent, extremely dedicated and passionate for this health system in our region. Literally works 25 hours a day, 8 days a week to make sure that our patients and all of our healthcare workers are safe in these trying times.
Thank you, Joe.
And to my left, who probably needs no introduction, is Pat Bradley, who is our Director of Communications and Emergency Management, who will also share with you some of the emergent plans that we have in place in anticipation if, God forbid, there is a surge in activity over the next few days or the next few weeks or the next couple of months. Well, we thought it would be important to give the community an update with respect to all of our efforts, and rest assured that the management team here and all of our healthcare workforce are working around the clock to make sure that our healthcare workers and our patients' safety is our top priority. Before I get into asking Dr. Bajwa to share with you some of the share some of his clinical knowledge with all of you with respect to the handling and precautionary measures. I want to share with you some of the recent policies that we put in place. And again, it's very fluid. We do everything in accordance with the guidelines from the Center for Disease Control, from the federal government, the CDC, and also the New York State Department of Health. And these guidelines come out not only daily, sometimes they come out hourly, depending on the situation. And I want to rest assured to all of you that we're up to date on all of the guidelines that continue to come out. With respect to visitation, and again, in accordance with New York State recent published guidelines, we have basically eliminated all visitation to the Niagara Falls and Sholkoff campus, with little exception. One exception would be for imminent end of life for visitation. Another would be within our labor and delivery. One visitor would be allowed for the mother and the newborn. And if there is a surgical procedure that would require a visitor to provide patient care when the patient leaves here, that visitor would be allowed to. We have basically locked down all of the doors to all of our campuses, and everyone is coming through the main entrance around 10th Street or through the parking ramp over the bridge. Every single employee, and we've instituted this a while ago, this isn't recent, but every single employee, any visitor, is screened before they start their shift. The screening for employees, some of them, it takes place multiple times to make sure we know where they've traveled, and also to make sure that their temp is in control. Obviously, if their temps exceed 100 or 100.4, they're not allowed in and they're sent home. So that has occurred and has taken place over the past week and a half. We have also contracted with a cleaning company to provide deep cleaning in many areas of the health system. ServPro has been on campus now for a few days, and we want to make sure that we continuously deep clean many of the areas where we have patient care, and that's currently being done. With respect to curtailing services, so let me comment a little bit about surgery, because we know there are some health systems that have canceled surgery altogether, others that have canceled elective surgery and only will provide emergent surgery. We watch this very closely, and the reason for systems canceling surgery or limiting surgery is not because the surgery is not safe. It's, we've all seen, probably many of you have seen the curve that the Surgeon General for the United States or Governor Cuomo shows in their presentations, that the concern is to tie up inpatient beds with elective surgical procedures. And if there is an anticipated surge in the need for medical patients to tie up beds, then obviously you want to limit the amount of patients that are having surgery occupy beds. So it's an issue of demand and capacity, hospital capacity, and you try to project the amount of beds that you may need for future medical cases, and you do not want to tie them up with elective procedures. So presently, we monitor this very closely. We monitor our bed situation hourly. We have asked our surgeons to very carefully monitor and review the types of cases that they are currently booking for surgery. So we are still doing surgery, but if there is a surge in activity where we will see, if we may see an influx in medical cases coming in that will require beds, then we will limit the amount of surgery that we will do going forward on an ongoing basis. And again, this is very fluid. And we are also continuing to do gastro procedures. That hasn't stopped, but again, we're very sensitive with respect to if it in fact requires resources that would take away from beds that we may need for medical cases going forward. So with that, I want to ask Dr. Bajwa, because one of the most common questions that's asked is if an individual becomes in contact with another individual who ultimately tests positive, what should that individual do?
Okay. So before I take your question, so I want to assure all our viewers and the staff as well as patients that our facility is safe. We are taking all precautions so that there is no spread of infection from outside in, or if we have a patient, we are not spreading it from patient to patient or from patient to staff. So having said that, and the surgeries are definitely, elective surgeries are safe to be done if patient doesn't have any sickness. The only reason is the bed surge. Like if we see so many patients at same time, we want to be having our facility ready for bed surge. So that is the only reason why some hospital systems, they are canceling surgeries, or Surgeon General advise that surgeries should be postponed. So this should be kept in mind. So we are taking all precautions, and if we feel surgery is unsafe, is not required for that patient on that day, we definitely will work with the surgeon and the patient, and definitely we will not put anybody in harm's way. So yeah, the question which Joe asked is if somebody gets exposed to a potential case or a known case of COVID-19. So I'm going to break this down into two parts. So like what is exposure, whether this person is a healthcare worker. So healthcare workers are now considered a priority workers. So even if somebody from our staff or other hospital staff, they get exposed to potential COVID patient, so recommendations are we are not like they are allowed to come back to work, but they require very stringent monitoring, which is a temperature taken twice a day. If they have any symptoms, they have to report immediately, and some institutions, based on the level of contact or exposure, mandates a mask before a patient care. Now, if this happens in community, so that is totally different. And so if I was traveling with somebody in a plane with the COVID infection, if I'm not sitting next to the patient, next to the known patient, or next, like 2 seats adjacent, 2 seats in front, 2 seats on back, so I'm not considered a high risk exposure. Only persons who are in very close proximity, like 6 feet of that diagnosed case, so they are at most risk of getting this infection. Otherwise, if we are passing in the hallway and there was a patient, it's not considered a very, very high risk. So based on like now there is a concept of social distancing, and the president has said 2 weeks that we should be considering isolating ourselves from community anyways. So if you get exposed, don't worry, stay home. If you have any symptoms, you have to call your healthcare provider. And why I'm emphasizing that, please don't come to our ERs or anybody's ER, because if you think you have infection, you are going to transmit this infection to the healthcare worker or patients who are in the hospital who are definitely sicker than general population. So the best advice is to stay home and monitor for any symptoms. Symptoms of this disease are mostly fever. If you start running fever, you have to call your healthcare provider. If you develop cough, that is also a symptom of this disease. So all those symptoms needs to be monitored. Other than that, I don't think so we need to be worried about this, because we know this is in our community and we have to deal with this in coming weeks to months. So the best thing is all hygiene precautions. If somebody is sick, they need to stay home. They need to keep their neighbors, co-workers safe. So the best way is by staying and isolating themselves at home. Definitely, if somebody is experiencing life-threatening emergency, they cannot breathe, their lips are turning blue or purple, or they have fevers which are very high, and they start having other symptoms, dizziness, chest pain, not feeling good. So those kind of things needs to be addressed, and definitely you have to come to hospital. But otherwise, just for fever and sore throat, best way is stay home and call your doctor.
Now, Dr. Bajwa, you had mentioned testing, and we all know that the testing kits, the reagents, are relatively scarce still. Niagara County, Erie County, Western New York, there is not a lot available, and I understand that Erie County lab just has basically enough to do the tests that they have pending now, and hopefully early next week they'll have more test kits coming in. You had mentioned that most likely it's in the community. It's just that we have people that have it that are not known but are carrying it. So, you know, we obviously aren't naive to think that because Niagara County, I believe now up to date, only has 4 cases that have tested positive in the county. But it's hard to believe that the reason why there's only 4 is because the virus doesn't travel over the Grand Island Bridge, or customs doesn't allow the virus to cross from Canada to Niagara Falls. So again, once all of this testing does become available, obviously there will be many more Niagara County residents, Erie County residents, Western New York County residents that will be tested positive. And that's what, when I was referring to the anticipated surge, it's not to say that everyone who tests positive is going to need hospitalization. Hopefully, Lord willing, very few will need hospitalization, and most will be needed to be quarantined at home.
Yeah. So I will take. So I'm going to split in two parts. The first is testing. So yes, there are many misconceptions about testing being freely available, and then I have heard many stories where a patient calls their doctor tells to call health department then says call back your doctor. So one thing to understand is not everybody requires testing. I wish we had that kind of infrastructure where everybody could be tested. So far, the capacity is limited. So the ground realities are that we are not getting testing in all the individuals we want. So it has to be prioritized, like who needs to be tested needs to be number one, number two, number three. So patients who are sick with bad pneumonia, they are in hospital and we do not find a cause, definitely we need to check them for this disease. If I am at home, I just have a fever, do I need a test? I wish I could get a test, but even if I'm not getting tested, with this community spread in New York State especially, I am going to assume myself that this is probably a viral infection, most likely caused by COVID-19. Best way for me is to stay home, self-isolate myself so that I do not transmit this to others.
For example, over the past couple of days, we have received probably a dozen requests from hospitals across Western New York for mutual aid for some of the supplies that all of the hospitals are challenged to keep inside their doors to be able to perform the kind of services that Dr. Bajwa and his team provide for our patients. Joe mentioned that the focus is on safety. Our first priority here is safety for our patients and for our staff. As he mentioned, everybody who comes into the medical center gets screened, medically screened. They're asked questions about their travel history and their exposure, and their temperatures are taken. That extends not only to our staff and to our patients, but any vendors that come in, any salespeople that come in, anybody who comes to the hospital to do business with the hospital undergoes that very regulated and very stringent screening. So we're being very careful about not allowing the virus to come through our doors. I'm very encouraged by the response that we've had from the staff here. Joe mentioned the meetings that we have every morning by telecommunications, so that we're doing those in a safe manner. The management staff and all of the line staff, the union and the non-union members here at Niagara Falls Memorial have stepped up in a very enthusiastic and meaningful way to provide services in a safe way, to learn what they need to do, to go the extra mile, to take that extra step, to take their game, as they say, to the next level, so that we're taking every precaution to be able to continue to provide high quality care to our patients and to the community. We also communicate daily with the Niagara County Office of Emergency Management, the Niagara County Health Department, the New York State Department of Health, and all of these agencies provide very meaningful support to us. We're also looking and projecting for the future in the event that things become even busier here, other places that we can go to and other resources that we could tap into to be able to provide support for our staff. So for example, Joe Ruffolo made a request this week to the Air Force Reserve, the Civil Air Patrol, to see if they would be able to provide personnel to help us with such things as performing those screenings as people enter the medical center, helping with environmental services here, helping out with the people that work in our kitchen staff. We're wondering and hoping that at some point, if the need arises, that the county will request from the state of New York assistance from the National Guard. If they do that, then we will certainly be at the front of the line asking for that assistance to come here to Niagara Falls so that we can marshal that assistance to help support the efforts that we have here. I think that Dr. Bajwa spoke about something that's very important, and that's if you think that you're symptomatic or you think that you have the symptoms of the coronavirus, that you don't just immediately come to the emergency department, that you should contact your medical provider or your doctor and ask for advice and see what your next steps ought to be. The purpose behind that is to keep people out of the emergency room who don't need to be in the emergency room. People who come into the emergency room are exposed to people, as we all know, who are sick. Those are the people who go to the emergency department, and we try to keep that distance. Social distancing is the concept that we all talk about now. So it's important that you get guidance from your medical provider about whether or not you really need to go to the emergency room, or whether you can stay at home, have a prescription called in by your medical provider, or take other measures to help you alleviate your symptoms. Joe?
Thank you, Pat. And, Pat mentioned our healthcare team. We have 1,250 healthcare team members, and we're very blessed with the dedication, the commitment that they have for the mission of the organization and for the health of the community. Many of them put themselves in harm's way. They kind of accepted that when we all took the oath of being a healthcare worker. And our physicians, we have also have a listing of over 40 physicians who have volunteered to go on a list. God forbid, if we needed them on a moment's notice, we would have 40 plus physicians coming in at one time, volunteering their services in various areas wherever the need may be. So we're very blessed with a dedicated team of healthcare professionals and medical staff. Dr. Bajwa, if a healthcare worker is in quarantine, what determines when they could come back to work?
So the quarantine for healthcare worker is a different concept. So yes, so this is now a tested positive patient basically. So that's the only time we're going to quarantine. We want them as our active workforce. So it's not just the exposure. So you are talking about like healthcare worker who was exposed in the hospital setting or in the community, and now is showing symptoms, and they got the test done, and now they are running fevers, and their test is positive in this patient. So the recommendations keep changing. As you said, it's a very fluid situation. So what we suggest that for 7 days, they need to be at home. And if they do not have any fever on 7th day onwards, so we can get them back in service under controlled environment. And again, they are going to wear a mask. They are going to be temperature checked twice a day or maybe 3 times a day, and watch for any worsening of their symptoms. Initially, we were doing like they need to have a negative sample 2 times before they can return. But if we start doing that, we're going to have a dwindling healthcare workforce, which is the worrisome thing, because we, as you see, like as the testing is getting little better each day, we are like catching many more patients. So we're going to have, so we have not reached the peak of the plateau, I should say. Like we want to avoid the peak, but we are still climbing the hill, and we have not reached that plateau. So numbers are still rising, and we have to be ready for that kind of situations. Again, these guidelines are going to change on an almost daily basis, but for now, we will not allow our healthcare worker who has active symptoms for up to 7 days. Once they are afebrile, they don't have a fever, they feel better, on 7th day, we reassess them and then bring them in a controlled environment. And if we have so many COVID patients, so now we can assign those healthcare workers in a specific sense. Like we will not mix, like have them take care of non-COVID patients. So those will probably be assigned to take care of patients who have a COVID infection.
Okay, just in closing, number one, with the schools closed, there must be an awful lot of teachers out there that are looking for something to do. And we are in need of volunteers. So if you are willing to volunteer few hours here or there, few days here or there. Just a warning, you will be screened before you walk in. Healthcare screening is done for everybody, but if you would be kind enough to dial 278-4440, it's Judy Villani, our Director of Volunteers. She would be happy to take your information, and we would love to have as many volunteers as willing, because we have many tasks that volunteers can certainly help us with. Because remember, we're open 24 hours a day, 7 days a week. And last, God bless our workforce, our healthcare workers, our nurses, respiratory therapists, our pharmacists, our aides, all of our workers. There's a saying, you save one life, you're a hero. You save 100 lives, you're a nurse. And we all need to keep that in mind. So we hope to do this periodically and continue to provide you updates as we get updated, and appreciate everyone making sure that you stay home when you know you need to stay home. Avoid the beaches in Sarasota, Florida, as we all saw in the nightly news, because the young can not only get it, but many of them could be carriers without even knowing it. And there is life after the coronavirus. So keep the faith. Thank you.